Welcome to the Telehealth Heroes podcast. On today's episode, we got Dr. Sprague-Connors, Gina, as I like to call her, because she used to work for Doxy.me several years ago. Gina, it's great to have you back. Thank you for joining me on this podcast today.
Thank you for having me. Good to see you. It's been a while.
Yes. So, for the audience, Gina worked for us while she was in her graduate school and residency, becoming a clinical psychologist from 2016 to 2019.
Yeah, yep.
Great. So that was before the COVID craziness, and she's been a diehard telehealth advocate. And so it's great to be talking to Gina again, especially after all these years with the COVID, how COVID changed everything. So Gina, you're a clinical psychologist. You specialize in telemental health, and you did your dissertation work on telemental health in rural communities before it was cool. What is it
Mm-hmm.
that, what got you into telemental health, and what drew you to this field?
Great question. I grew up in a rural area. I grew up in Wisconsin, the Midwest. I also went to a polytechnic university. Before I went to school, before I went to college, I actually did video conferencing for AP courses. And so I got to get the opportunity to work with other students in other communities through video conferencing who had professors that could be teaching these AP courses in preparation for college. I went to a school, UW Stout, that is a laptop program that integrated technology into the curriculum and studied psychology there. I also got the opportunity to be in a rural area in my undergraduate. Menominee, Wisconsin is not that big of an area.
Yeah.
And as a result, I got to work at a really cool nonprofit called Lutheran Social Services and do a lot of community mental health work in people's homes, really supporting people who had limited resources, supporting people who needed kind of 24-hour mental health support. And so I got a firsthand experience from undergraduate of what does it look like to be somebody who is struggling with mental health conditions, or perhaps family members who just really don't know how to support or who to turn to. So I feel really grateful, and that kind of springboarded my career into mental health. I went on to get a master's degree in counseling and clinical psychology, and later on a doctorate, where I really chose my dissertation topic to integrate both of these pieces in terms of rural and technology integration.
Gotcha. That's fantastic. So you certainly see a lot of value in using telehealth for rural care. What are some of the biggest benefits that you see patients receive? And what do you hear from patients in these rural communities who are able to receive these services through mental health or telemedicine?
Well, I think one of the things that you have to look at is really looking at the culture in rural communities. Oftentimes, people really do know each other. We're talking about intergenerational families. We're talking about families that, or schools that are very small, communities that are very small. And so sometimes one of the biggest benefits is, nobody knows that I'm going into the mental health clinic in town, because I'm doing this from my home. So there's a lot of privacy. Also, too, if you are doing this work in telehealth, there is less of an opportunity for multiple relationships if you are not actually residing in that area. I think, too, one of the coolest parts is being able to provide really specialty care. Sometimes the opportunities for clinicians who have specialty training in certain types of treatment modalities or treatment approaches, sometimes that is not accessible. But fortunately, with telehealth, we can have people from all over really providing quality care, and also supporting systems that are just really overburdened. Really being able to retain quality providers, really being able to be fully staffed ever. So thinking about all of these different things that impact somebody who's just living in a rural area and just looking to take care of their well-being.
So it's really people without telemental health or access to these specialists by mental health, they might not be able to receive it. Just that's the way it's set up there. But by having telehealth, you have greater access to these experts.
Absolutely, absolutely. And being collaborative, I think there's always a really great approach to collaborate with, local providers and being able to get a second opinion. I think sometimes that puts people at ease to be able to have, multiple ways to kind of get to an answer, get to a diagnosis, or really understand, symptoms, and really looking at the whole person and looking at all of the different pieces and history.
So it sounds like telemedicine, telehealth provides value to a lot of patients in rural areas, but we know that it's not wide, completely widely accepted by all providers. In your research and in your experience, what are some of the biggest reasons why providers and clinicians, therapists are resistant to making full use of telehealth?
I think there's a couple of different things that we have to really look at from different vantage points. One of them being one of our responsibilities as healthcare providers is to really help people to be safe. And what I mean by that is sometimes we're dealing with people who are in a crisis. They're a danger maybe to themselves or to somebody else. For instance, having suicidal ideations or homicidal ideations. And so I think that's a huge piece of this is like, how do I support my patient if they're going through a crisis? And, one of the wonderful things that has actually come into play here in the last year is 988. It started in July of 2022, which has been a huge piece to needing that additional support. People can now call 988 and they can reach somebody to help them in a mental health crisis. And that's for everybody. Versus, we used to have 911 and oftentimes those mental health crises would go through there. But at times, using that way can sometimes escalate a situation. And some communities don't really have a crisis mental health team. Where I'm located in Eugene, Oregon, we have a great one. It's called Cahoots, and they actually have mental health crisis staff members that drive around. They will pick patients up and get them to an inpatient unit, but not every community has something like that. So really looking at those different pieces and how can we support, and I really do think we need more federal support and state support to integrate these crisis teams, because 988 is a great resource, but again, oftentimes people maybe don't know about it. It's still pretty new. Sometimes I meet a new patient and they're not familiar with it. And so we need multiple ways to get people connected with that type of care. I think another one, just too, is like technology can be difficult, an update needing to be navigated or an application not working. And so that can be a real barrier for both the provider and the patient in terms of really being able to have a good quality session if you're spending, time trying to troubleshoot an issue, or if, the patient is really struggling or the provider's having difficulty maybe in their location with high-speed internet. These things can really kind of change the whole experience of going in for a therapy session or a mental health treatment approach, like group therapy or couples therapy or family therapy.
Mm-hmm. In your time as a provider, what are some personal experiences you've had where you've seen, wow, telehealth has really impacted this person and really helped where they might not have otherwise been able to be helped?
Yeah, so one of the things that I have found it to be really impactful for me is seeing, people who work, maybe they travel a lot, and it's taking a real toll on like a marriage or a partnership. And so telehealth really allows for this opportunity to engage in therapy with a partner or do some of the interventions together. The other thing is, sometimes some of these specialty treatments related to sleep or trauma related disorders or, severe mental illness, sometimes people really don't feel like they can get into the clinic. Sometimes rural places really do have transportation, barriers in terms of like Uber being accessible or a bus, or, maybe it's inclement. And so great distances to providers or different areas of the country that just get really difficult weather. So it's hard to get in person. And so to be able to get on a video in the comfort of your own home and your own space and feel safe, this is a great approach.
Now, your research while you're doing your doctorate was on telemental health. Can you talk a little bit about that research and what you learned?
Yeah. So it was really cool. I had so many great opportunities to speak at different conferences. I, got an opportunity to, connect with you. I actually, how I connected with Doxy.me was through a professor who utilizes Doxy.me, the Ronald McDonald House. And he was like, hey, have you ever heard of Doxy.me? And then I ended up filling out that info page and ended up connecting with you. And that's kind of how our journey began. But some of the other things in terms of like my research and what I ended up doing for my dissertation project, I presented at a rural conference, actually at UW Stout, for drug and alcohol abuse, and connected with other clinicians, teaching them a little bit about some of the different interventions that can be done through telehealth. My dissertation chair was really clear when I defended. He said, you did a really amazing job of doing a thorough overview of telehealth. I really wanted to look at the ethical implications. I wanted to look at both the strengths and the limitations in telehealth, as well as rural communities. And then I did a broad overview of different telehealth interventions, everything from pediatric care, talking about like emergency care. There's a lot of data, and I've heard some of your other guests on the podcast talk about this, but the cost, the reduction of cost for people to really get good quality care and at a fraction of what it used to cost is really impactful for families and for children to get the interventions that they need for mental health. One of my most favorite interventions for telehealth is actually when we're talking about applied behavioral analysis for autism spectrum disorders. There's been some really great research on that, on supporting families, supporting children, clinicians being able to really see what's going on in the home and support families in utilizing the interventions that they're working on with the patient or the child. I think that's an amazing modality. Some of the other ones that we really, thinking about are opportunities for connection, groups. I think groups are really great, especially if you can connect people from varying places who maybe have a commonality. Maybe it's grief, or maybe it's, a different type of disorder that they're just managing symptoms, and it's really, really challenging. And I think too, we're seeing more and more data to highlight, like, can we compare in-person intervention to telehealth? And telehealth is right up there with in-person interventions. And so, I definitely think COVID springboarded everything, but it's not going away. And I think it's really beneficial to us to be well-rounded as mental health providers and thinking about, is this a great modality? Can I support my patient and still help them, complete their goals and meet where they want to be?
So you did your doctorate research on telemental health before COVID. If you were to
Mm-hmm.
do that same work today after COVID,
Mm-hmm.
how would it look different?
Oh, I think one of the biggest ones is, in the research, and both when I presented at various conferences, I saw, people really talking about like a pushback and a lot of struggle with it. But like COVID required us to evolve. It required us to rise. It required us to really engage people, because people were in dire places. People were losing family members. People were struggling with, the changes that impact on their jobs and finances. And, I think we can't lose sight of that. And some of that still really does apply today. And I think it really We have to think about this as a tool, an extension of our tools that we learned in graduate school, tools we learned in supervision, tools we learn in consultation and through our continuing education. I really think that we are going to be kind of working with a deficit if we're not integrating this in some thoughtful way.
Mm-hmm. Gotcha. What does the future of telehealth look like?
I think we're going to see more integration of things like AI. I don't know if you've looked into any of that, but there's some really interesting tools there in terms of supporting people in doing the care that they're providing. I think too, we're going to see more smart phone devices. I think it's really cool too. In terms of my dissertation, I talk about some of the smart home devices. We're seeing that more and more, but that can help people really age in their home.
Yeah.
Staying at home and not having to go and get as many supportive pieces, because technology is just going to really support them in the space that they're in. I also think too, we're going to be evaluating like, where is this not a good idea? And looking at some of those more nuanced, in more and more researchers going to highlight like, this is a great option, or maybe this hybrid approach is a great option, or just really looking at some of these nuances that we didn't really see previously with each type of disorder, each type of intervention.
Mm-hmm. Mm-hmm. What are some of the barriers that we have to figure out in order to get to that ideal future state that you envision? I mean, a lot of people use telehealth now, but what are some of the challenges you say, we still got to address this before we also get to that ideal state?
Yeah. So I think the biggest one is really getting federal support for, we think back, I'm going to date us a little bit in terms of like legislation, but thinking about the Rural Electrification Act of I think it was 35, where everybody was able to have a telephone access. We need that for high speed internet. We need that to be a high priority item. We also need to think about like access to smartphone devices, iPads, iPhones. Like, we look at the data and we do see that more and more families have access to that, but these devices are really expensive. So how do we use some of the resources within the community to be able to create spaces where people could potentially utilize a computer and a device to engage in their healthcare? And so whether that's going into a clinic, whether that's going into a private space, I think COVID was a huge push in terms of like people working more from home. So thinking about, what are some of these spaces that used to be offices that aren't used as often? Could they be kind of turned over into that piece in terms of telehealth? And then I definitely think, we have to think about, how do we support this boom of telehealth? I think there are some concerns out there. I hear it in the field of psychology. I hear it with other colleagues who are counselors or who are social workers. Some of these companies, these large growing telehealth companies that are expanding with many, many providers, they're facing, some critiques about licensure and
Mm-hmm.
expectations and really making sure we're following guidelines. And I think we're going to have to really create a standard for some of those larger organizations that just really boomed over the pandemic, because I've been hearing about them in varying degrees through ethical considerations. And, we want to be doing no harm. We want to be supporting people's well-being. And we need to be doing that in a thoughtful way, and we need to evaluate where there's being errors made.
Do you see the mental health industry moving towards these larger centralized organizations that have a bunch of providers that manage patients through their technology? Or do you see it continuing to stay more the independent provider that they just use technology with their own patients?
I think it's going to be both, and I think it can be both. When we think about other fields, think about the tech field,
Mhm.
think about the transportation field in terms of airlines. Like, there are smaller airlines, there are larger airlines. Like, we have to think about this, and there's room for everybody if we're doing good quality care. Frankly, that's all that matters to me. And I hope that, we make room for everybody. And I've heard other speakers on Telehealth Heroes talk about that idea that, like, there's room for people in private practice. There's room for larger organizations. And in fact, I think it would behoove us to work collaboratively, because it is our community, it is our country, it is our world. We need to think about that from a human perspective.
The need for mental health providers outpaces the supply to address it.
Mm-hmm.
And so in such an environment, whoever's doing the job will be busy. And so I think because of that, both will exist, can and will exist. And for some people, having that one-on-one personal connection with their own provider is what they need. For other people, going through some technology process, a big machine, is what they need. And I think having those options, both options available, does make sense. And at the end of the day, are the patients getting the treatment that they need? And
Mm-hmm.
is it working? Telehealth is there to make it more scalable, make it easier to access, and if we can help contribute to the mental health gap that we have in this country, then great. So,
Yeah.
so Gina, you have a mule,
Yes, I
and
do.
and so tell us a little bit about the mule and how you incorporate that into your mental health work that you do.
Oh, very cool. I'm so glad you're asking me about this. So I've got Cecil. He is a 5-year-old quarter horse cross. He's a dapple rose gray. I'm going to be doing some equine assisted therapy. I'm actually in my barn right now. I know it might not look
Oh,
like that, but my office is in my barn. So he will be residing behind me. And actually, probably the next week, that's the goal. Was busy doing some things over the holiday weekend, building fence. But I'm hoping to integrate. I'm going to be starting my own private practice and integrating equine assisted therapy. I have a lot of passions. I'm working with a local organization that does a lot of work with human trafficking victims, and I'm going to be doing some pro bono work for them, as well as really supporting some of the victims in terms of trauma treatment, and then incorporating my mule Cecil, and he will eventually have a little friend here, and I have some barn cats here to manage the tall grass and the other little critters that hang around. And I'm also, really passionate about suicide bereavement. So I'm looking to also work with some of our law enforcement and some other organizations. I actually have been completing a certification through Path International. They do a lot of work with integrating equines into treatment. And so I did some additional work here in Oregon with a local farm that integrates mental health treatment. So that's what I'm going to be doing with my private practice, doing things like individual therapy, group therapy, and couples therapy, integrating equines, and also integrating meditation into this space, because I'm in a really beautiful spot here on a little 5 acres, and it's going to be fun. And I'm going to be doing both telehealth and in-person care, so it's going to be collaborative.
that's great.
And if you're looking to check it out, I'll be really integrating some of those pieces. I'm on Instagram, Mule Mind Therapy. So give a look. Haven't been putting too much out there just because I've been super busy with so many different irons in the fire, but it's going to be going here in the coming months.
So you'll be riding the mule while you're on a video call with your patient. Is that how it's going to work?
No, no, no. And definitely, they might hear him. I've been warning people, they might hear him because he does bray pretty loud. It'll be interesting to see how it works with him at the farm. He's being boarded right now, and he bellows when he hears me walk into the barn. He can't quite see me, but he can hear me or my vehicle,
Yeah.
and he will bray. So it'll be interesting. But
Hopefully.
no, nothing like that. And really, the idea is that we're integrating in a thoughtful way. I'm putting together right now a psychoeducation series and teaching people just some general mental health pieces, integrating equines to kind of be an experiential activity and exercise, and helping them to kind of integrate that into their life and their well-being.
Well, great. Well, fantastic. Well, Gina, it was great to catch up with you today. Thank you for sharing your knowledge with us, and definitely good luck with your mule therapy. I'm going to call it that because I can't remember everything else.
Mule
But
minds,
mule
mule
minds,
minds.
there we go.